Namaste Vidya, Hamisha Khush Raho Vidya. A very good morning to you all. Myself, JV'n Dr. Ravi Jain, Assistant Professor, Department of Practice of Medicine, in Faculty of Homeopathic Science at JAYOTI VIDYAPEETH-FHS University, Jaipur. In today's lecture, we are going to discuss about the investigations for various hematological cases. If a hematological case is coming to you, what are the various investigations that could be done in such a case? There are a lot of investigations that are needed to be done in case of hematological disorders. The investigations includes hemoglobin. The normal hemoglobin range in female is 11.5 to 16.5, whereas in males, the normal range is from 13 to 18 mg per dl. You can check the RBC level. The RBC is 3.8 to 5.8 into 10 raised to power 9 per liter in females, and the normal range is 4.5 to 6.5 into 10 raised to power 9 per ml per liter in males. Check for the level of ESR in mm for the first R. It is zero point 0.7 in female. MCV is 78 to 98 gram per liter. MCH is 27 to 32 picogram. MCHC is 30 to 36 gram per deciliter are the normal ranges. Then you have to check for the platelet count into 10 raised to power 9 per liter. That is 150 to 400 into 10 raised to power 9 platelets per liter of blood. Then you have to check for the WBC count. The WBC count is mentioned into 10 raised to power 9 per liter. That is 4.0 to 11.0 into 10 raised to power 9 per liter. And then you have to check for the PCV. PCV, the normal range in female is 0.37 to 0.47, and in males it is 0.40 to 0.54. After checking for the hemoglobin, RBC, ESR, MCV, MCHC, MCH, platelets, WBC, and PCV, you have to check for the DLC, differential leukocyte count. In the differential leukocyte count, you have to check for the neutrophils. The normal range is 2000 to 7500 to 10 raised to power 6 per liter. You have to check for lymphocytes, monocytes, eosinophils, basophils, reticulocyte count, serum ferritin, red cell mass, blood volume, serum folate, RBC folate, and serum vitamin B12. The range of each of them is mentioned in front of you. So you have to check for all these details. You have to check for different things in DLC, that is neutrophils, lymphocytes, monocytes, eosinophils, basophils, reticulocyte count, serum ferritin, red cell mass, blood volume, serum folate, RBC folate, vitamin B12, because each one of them has its own significance in the hematological disorder. Then you have to prepare a blood film for various things. You can see a lot of things in the peripheral blood film. You can get microcytosis, macrocytosis, hypochromia, anisocytosis, poikilocytosis, eleptocytosis, or ovulocytosis. You can get target cells, polychromasia, and reticulocytosis. You can check for Hobble-Jolly bodies, punctuate basophilia, nucleated red cells, or erythroblasts. The description is given below, and each has its own significance. Microcytosis is found in case of iron deficiency anemia, sideroblastic anemia, and thalassemia. Macrocytosis is found in case of macrocytic anemia, megaloblastic anemia. Hypochromia is seen in case of microcytosis, and hypochromia are commonly associated and caused as the same as microcytosis. Anisocytosis is found in many cases of anemia. It is predominant in megaloblastic anemia. Poikilocytosis is always present, but anisocytosis reflects dyserythropoiesis. Eleptocytosis or ovulocytosis is associated with megaloblastic anemia as iron deficiency anemia as a hereditary disorder. Target cells are seen in case of liver disease after splenectomy or hemoglobinopathies. Polychromasia or reticulocytosis is seen with accelerated erythrocytosis. Hobble-Jolly bodies are seen in absent spleen and megaloblastic anemia. Punctate basophilia can be seen in severe anemia, chronic lead poisoning, beta thalassemia. Nucleated red cells is seen with accelerated erythropoiesis, leukemia, and infiltration by cell tumor. Leukoerythroblastosis is seen in case of malignant infiltration of myelofibrosis and reactionary secondary to excessive blood loss or hemolysis. Then you can do the bone marrow examination by doing the lumbar puncture. Bone marrow examination is done by taking sample from the bone, and you can also do the coagulation profile for checking the BTCT and total prothrombin line. So this was all about the examination in case of hematological disorder. In the next lecture, we are going to discuss about the lab findings in acute leukemia. So this was all for today. This session is powered by digital version 2.0 Jyoti Vidyapeeth from University. I hope you are satisfied with my digital session. If you have any query, please mention in the comment box in our episode. This was all for today. Thank you very much. We will be meeting in the next lecture.